Hi everyone, I hope you guys are keeping well. In this video, we have another series of MRI report explained, and we're going to talk about spondylolisthesis. We're going to talk about what is the cause of a spondylolisthesis, what are the symptoms, and what are the treatment options that you can basically apply at home for your recovery. If you've never been in this channel, my name is Bob. I'm a physical therapist, and the purpose of this channel is to help people like yourself with simple tips and exercise for quicker recovery. Make sure to subscribe my channel for my weekly update, and don't forget to press that like button. Let's get started. Spondylolisthesis is the result of advanced degenerative disc diseases. It's a condition that discs degenerate and resulting in the loss of disc height. This condition causing instability in one vertebra to slip forward over another one below it. Other cause of spondylolisthesis would be stress fracture or congenital abnormalities. There are some rare causes such as tumor and trauma. Degenerative spondylolisthesis is a consequence of aging process in which the bone, joints, and the ligaments in the spine grow weakened and become less able to maintain the alignment of the spine. This type of spondylolisthesis typically occur at one of two levels of lumbar spine, L3, L4 or L4, L5, which is the most common one. Degenerative spondylolisthesis is more common in people over age of 50, and in particular among individuals over age 65. Women are 2 to 3 times as likely as men to be diagnosed. Spondylolisthesis can cause impingement of the nerve and fatigue of the back muscles, and may result lower back and leg pain. The symptoms of spondylolisthesis may be lower back and leg pain, sciatica, an aching pain in the hip, buttocks, and lower back that radiate into back of the thighs and the legs, a shuffling gait when walking, or weakness in the lower extremity, or abnormal posture. If you experience any of these symptoms, we would recommend you to visit your physical therapist and ask them for advice. After correct diagnosis of spondylolisthesis, your physical therapist will recommend you a treatment plan which is included physical therapy and strengthening exercises. You may rest and restrict certain type of activity to minimize your pain in that period of time. Injection sometimes would help with reduce the pain and swelling, and you may take some medication and analgesic to reduce pain and swelling. Alright guys, I'm going to share with you a series of exercises right now that you can start your rehabilitation, and this exercise can help you to reduce your pain and discomfort and help you to improve your mobility. Beside that, I have 2 separate exercise routines for spondylolisthesis that I've shared before, and if you've never done those routines, I'll leave a link below and you can check them out and slowly progress to this routine. If you haven't liked this video, definitely try to like my video. If you haven't subscribed my channel, make sure to subscribe my channel for my weekly update. Alright guys, the first exercise that I'm going to show you in this routine is going to be hip bridges with the progression with the resistance band that I've shown you in the previous routine without resistance band, and we're going to add on resistance band around the knee, and with this progression you can actually activate more of your glute and your hip muscle, and that helps you to reduce your pain and improve your mobility. Let's give it a try. You're gonna lie on your back. Basically, you can use any type of resistance band you have, but it should give you some sort of push and challenge. And you're gonna bring it above the knee. You're gonna lie on your back, hands next to your body, and while you're pushing your knees out, you wanna go for a hip bridge. The tempo is slow. You're gonna go for 3 sets of 8. Control down, push back, and at the top you can actually feel your glutes are engaged and you're pushing the knees out. We're going to try this exercise for 3 sets of 8 to 10 repetitions, and while you're doing this you want to avoid that knee movement. You want to push the knees out. Try this exercise and let me know if you need any help. All right guys, the next move, we're going to progress the normal bear dog exercise to bear dog with resistant band. I'm going to show you how to do it. You can give it a try. You need a resistant band with a decent height that you can basically use in this exercise. Let's give it a try. Basically what you're going to do, you're going to hold two heads of the resistant band underneath of your hands, and you're going to hook up one of the, basically the middle side in your leg, and you can hold, and basically you kind of adjust it around middle of your foot, and you're going to be in the quadruped position, hands underneath of your shoulder, and we're going to basically start with single leg kickback. Slow control. For all you're doing this exercise, you basically want to maintain your back straight, and this is the first progression to single leg kickback. And when you got comfortable with this exercise, you're going to progress it to the full bear dog, and you're going to hold both head in one hand, usually in the opposite side. This is the side that actually moves. I'm going to adjust this, hold this underneath of my hands. I'm going to now move one hand and one leg at the same time. Alternate side, slow control, fall back. For all you're doing this exercise, you're going to maintain your back movement. It's pretty challenging. You got to practice this in both sides. Try to pick a very kind of like medium strength resistant band, not very hard, because that's going to make things more challenging. You want to start getting the movement and slowly progress the colors. All right guys, we're going to move on to dead bug. That is an effective core exercise. If you're suffering from spondylolisthesis, this exercise can help you to strengthen your core, at the same time create more stability in that area. I'm going to show you how to do it. You can give it a try. Dead bug is an advanced exercise. If you haven't done it, you got to be patient. Even sometimes I find it's pretty challenging to do it, but I'm going to show you how to do it. You can give it a try. Knees 90 degrees bended in this position. Your back shouldn't be off the ground. Basically it's flat, and you can feel the pressure on the lower back. You want to maintain that pressure while you're basically holding this, your knee in this position. Hands going to be in this position. What I would suggest you to do, start with just moving one hand, opposite leg, while you're maintaining that pressure here. All right, let's give it a try. You're going to go with the left arms, right knee. Now switch side, right arms, left knee. The most important thing is that your back doesn't shift off the ground. You've maintained that pressure here. Now we're going to do alternate. Control to one side, 3 repetitions. Slow and controlled, breathe in and out. And now switch side. Breathe in and out. Maintain the pressure on the lower back. Now, in dead bug, you're basically in a slow tempo. You're not going to rush in this exercise. Learn the technique gradually. Try one side initially and slowly progress into basically limb moving at the same time. Give it a try and let me know if you need any help. All right guys, we're going to move on to reverse crunches with the feet ball. If you don't have a feet ball, you can use a pillow at home. Whatever you can hold between your legs, that will do the job. It shouldn't be very heavy, but I use this as an incentive of that actually holding something. Now, you can give it a try and see how you're getting on. Basically, you're gonna hold this between your 2 legs, and your back is gonna be in neutral position. Hands can be basically around your pelvis area. And what we wanted to do, we wanna basically go for reverse crunch, which means rather than you coming up, you bring the knees back towards your chest. Stabilize the back, control, and we're gonna go up. Slow back, starting position. It looks pretty easy, but it's not easy. As you can see, I'm pretty shaking. You're gonna go for 3 sets of 8 to 10 repetition. And eventually, if you find this exercise is difficult with a feet ball, you can actually do it in a body weight. I'm gonna show you example how to try with body weight, and you can give it a try. You're gonna lie down in the same position, feet next to each other, hands next to the body, and you're going to literally shift the hip off the ground, slow control, back up again. As you can see, I'm not bringing my legs back. That shifts my lower back off the ground, and that's not exactly what we're looking for. I'm gonna show you one more round. Slow control, breathe in and out to here and back. Now, the more you do this exercise, it becomes more basically easier. You gotta practice on it, be patient with it. You can try it once or twice a day or 3 sets of 8 to 10 repetitions. If you find the feet ball is too heavy, use a towel or pillow between your two legs, that will do the job. The last exercise that I'm going to share with you guys, this is an advanced exercise that we call Romanian deadlift. If you're suffering from spondylolisthesis or disc bulges, this exercise can be a very beneficial exercise for you to recover. At the same time, build your confidence because you will learn how to hip hinge and learn how to actually lift the stuff from the ground. I'm using a very light dumbbells, like 3 pounds or 3 kg, whatever you have at home. If you don't have dumbbells, you can use bottle water, whatever you have, that will do the job. I'm gonna show you how to give it a try and you can give it a go. Okay, in the Romanian deadlift, you want to be shoulder width apart. I'm gonna show you in 2 different angles. And you're gonna hold the basic dumbbells or whatever weight you have next to your body, and we're gonna go for a hip hinge, which means we're trying to avoid bending your lower back. We're trying to hip hinge from the hip. Slow control down, weight is next to your body and coming back. Your range of movements, whatever gives you, which means as far as you feel comfortable, you can move that far. Don't force it to go too low. You want to go slow tempo. As you can see, I'm not holding the weight here. It's pretty close to my body, leaning forward gradually, below my knees and coming back. My basically pivot is from the hip, which means I don't lean forward and hunch. I try to keep my shoulder tight and bend from the hip. I'm going to show you from this angle. Feet shoulder width apart. Keep the back nice and tall. Slow control down below the knee and push back up. You're gonna try with 3 sets of 5. And if you find the weight is actually bothering you, you can do the same thing without weight, which means you hold the body, hands next to your body, lean forward and back. Slow control down towards the knee and come back. Now, if you've never done hip hinges or Romanian deadlift, I leave you a link below this video that I've described how to start to learn hip hinge and progress them gradually, and that would be a beneficial routine for you to start with. And that can basically put you in ease and not rushing to something pretty advanced. Give it a try and let me know if you need any help. Thank you for watching this video, guys. I hope you find this information helpful. If you have any question or concern about your MRI report, your back pain, your disc bulges, or anything that you suffer, leave me a comment and I will definitely get back to you and answer your question. If you need further assistance, you can always book an online consultation with me with the link below, and we can go through a customized plan for your recovery. Make sure to subscribe to my channel if you haven't yet, and don't forget to press that like button. Leaving me a comments or basically liking my channel can help me with Google Analytics, and I can basically spread this information for people like yourself who need help. Definitely make sure to leave me comments and like my videos. Until next week, all the best.